Alors avec nous pour cette conclusion, deux invités de marque, Anne Thiébauld qui est avec nous évidemment.
With us, we have two guests, Anne Thiébauld with us from the French CNAM on professional or vocational diseases, and Stéphane PIMBERT, the General Manager of INRS. And now we'll try and draw a number of lessons from that debate. I know it's very complicated because we looked at hybrid work, hybrid companies, which is a new world. Anne Thiébauld, what would you say about this? Now that we have hybrid forms of labor, how has this impacted the CNAM, the vocational risks insurance units, and how much did you have to review in your modus operandi? Well, this is a great opportunity that you're giving me, so that we try and build with Mr. PIMBERT, we try and build on the experience acquired. It's a bit too early to do this, but that's the role of the INRS, the scientific lab, to do that and to adapt the modus operandi to telework and other forms of work, as you were saying, hybrid forms of work, or other technological changes. I agree in saying that the crisis has accelerated change. We saw that as well at the French social security level. We've started working differently with companies in a bilateral way. We've supported companies in the field of prevention in very specific cases. We've organized webinars, and we had distance sessions, remote sessions as well. And at the end of the day, we developed teleservices faster than what we would have done before, and with a broader scope. And we have earmarked funding to adapt to the crisis. It really shows that we've reached out to a new audience, that is the SMEs, SMBs. They're far away from vocational risks and evaluation of those, and the regional branches are the local agents on the ground, and the prevention officers have a business recovery plan for 13 industries. That was a massive plan, and we did that swiftly thanks to the crisis. And then the hybrid forms of labor, that's true. The prevention officers and our civil servants adapted, and they've experienced that. They know what the effects of the health crisis were and what telework means.
Both in their professional environment and in the way they can work. Now, we've seen that this morning as well, and throughout the day. There's also a question on the nature of risks and the nature of exposure because of the hybrid setting, also the mobile work, being much more autonomous in your work. Do you identify new risks at INRS? Well, there are obviously new risks, and the panel session this morning and this afternoon highlighted this. However, it's also, part of these risks are also very conventional ones. We've tried to give some thought to the risks associated with teleworking, and one can say that it's fairly conventional, the work environment, the tools and resources, the technological tools that are used, also the autonomy and the workload. These are things which are well known to us. However, when it's a teleworking setting, different sets of questions should be asked, such as because they have to be revisited. It's one thing to work in the office or to work at home or to work from home. And also the collective working practices are also absolutely crucial, as we could see during this crisis. And also what sort of changes it does imply for the organizations. Changes were accelerated during the crisis, but there are also other risks that are very conventional at INRS. We are going to organize a roundtable on the day of the International Day for Health and Safety at Work with the ILO, and we are going to focus on the risks associated with teleworking, and also highlight in what way some of these risks are conventional, such as the relationship with managers, collective practice, collective or working as a team. And in your view, despite these risks being quite conventional, do you think that it does call into question the positioning of the various stakeholders in prevention? You conducted some work with several stakeholders, and we could see this morning that it's very difficult to know who does what, who's in charge of what, and also how things are not so, the lines are very blurred. Yes, indeed, and this is what I mean with the changes in the organizations and the new style of management. Of course, this was radically different with teleworking, such as we knew it during the pandemic. And it's different when you have people at the office 2 or 3 days per week. And of course, this means different relations. Now, in link with what we said this morning, this afternoon we highlighted the doctrine, the need for a doctrine, for some guidance, like what sort of recommendations can be issued when, and to which should we comply when you need to choose an exoskeleton, for instance. Do you think that the various stakeholders involved in prevention, all of you are going to have to reposition yourselves? I think that the strength of the ATMP agency is also to highlight the major common points. Now, we've been told by many today that it all starts with a diagnostic, with the identification of the workstations with the highest risks. Now, this is a method which is fairly conventional, and you find this not only in health and safety, but also in public health environments. And I think for social security, it's important to be able to identify the common basis and then work out the methods that are going to be needed. We do have a program, for instance, which is called TMS Pro, Musculoskeletal Disorders Pro, and we've been rolling it out in many companies. And it has been shown that once they implement this program, There is a reduction in musculoskeletal disorders, but we do have standards and programs that are really very robust and very reliable, and it's, of course, our duty to roll them out and make them known. Now, it seems that automation is also something to be considered because with the exoskeleton, with teleworking, it means more and more autonomy for people. They are increasingly responsible for managing the risks, managing the equipment. So you can't really have a top-to-bottom approach because you can't just instruct them to do this or that. They enjoy too much autonomy, but you need to train them on how to cope with the risks and control the risks. So do you think that the employees who are concerned should be trained properly upstream? Yes, indeed, we need to take into account the use of these tools, such as exoskeleton, for instance. You can't just don an exoskeleton. You need to make sure that the exoskeleton is embedded in the working practices. So you need to take into account the needs and the behavior of employees. We ran a number of experiences, of experiments, more particularly at the teaching hospital in Nancy with exoskeleton, and also in a slaughterhouse. So because you need to test out the exoskeletons, and you need to include that, you need to integrate them in the working organizations. And then training is needed, obviously, so that employees can take all these new tools on board and use them accordingly. With the health crisis, we have seen an increasing number of e-learning, e-training, and of course you can't just run a 5-day training session, 7 hours a day. It's not possible. So we worked on, we made sure to take into account the trainees' feedbacks. So what about the horizon? What about the future? Is it going to be a hybrid company? Is this going to give rise to a new guide by the health insurance organization? You also said several times, and several people said so, with the crisis we were able to see the gap between the gender gap when it comes to teleworking, but also the difference between people in call centers, people who are first-line workers, the difference between people who are properly covered by the insurance and people who don't have a say and were not able to get sufficient protection. So there are a lot of inequalities. Faced with a very likely continuation of these working environments, what can you do in order to address these issues? Yes, indeed, with the crisis, we were aware, we became more aware of the inequalities. So, obviously, I share your view. It's important to offer an appropriate level of social protection irrespective of your work. In our agency, the ATMP section, it's something which is totally funded by employers, so it doesn't include platform gig economy employees or workers, rather, or neither does it include self-employed people. Of course, we'll have to do something about it one day. We can see that platform workers are difficult to take into account because it's sort of a hybrid status. But I think that France has been quite good at tackling these changes, and I'm sure that it'd be even better in the future with some adaptations. Of course, it's too early now to share with you the content of our guides, which is going to come into force as of January 2023. Now, prevention. The prevention environment, but also other environments were quite upset. But during and because of this crisis, however, I think that now we are aware that our organization should do more to reach out to SMEs. We've seen also that being present on social media is something which is quite fruitful. So I'm sure that we will continue to work on these along these lines, while obviously taking into account these all these conventional risks, because many of these risks are very conventional risks. There's also an environmental risk to be taken into account, and not only the risks associated with the workplace. This is exactly what happened with COVID. So we need to anticipate and preempt future crises. What does it mean for the health insurance organization and for prevention experts? What does it mean for you? How is it going to change your remit, your scope? Yes, you're right to say that there are lessons to be learned from this pandemic. It seems to me that were we to make sure that we better adapt ourselves to changes in the environment and in the ecosystem, well, you need to be able to detect weak signals. And when it comes to prevention and compensation for work accidents, I think we need to work more closely with the healthcare providers and also employees and employers. There's a legislation, the legislation on health and safety at work of 2021, and of course we are in the ideal position in my organization, because we are within the under the umbrella of the social health insurance. So we need to do more in order to make the most of this relationship with healthcare providers. Last point, Mr. PIMBERT, these environments, future settings, workplace environments are going to be awash with drones and apps and new technologies. Of course, one may wonder about the proper use of all these new tools. As Marc Malenfer was saying this morning, maybe it's possible to work to do something upstream and work with the designers of all these tools so that they make sure that health and safety is embedded right from the design stage. What can you do so that you become more proactive and this all becomes more efficient? Now, we've been discussing with designers for many years now, in particular for forklift trucks or exoskeletons. We've been discussing with designers and engineers and manufacturers. So this, these exchanges have been in place for many years now. However, when you take the robotics, the man-machine interface, for instance, in the automotive industry, it calls for prevention with the workers themselves, but also with the people who are responsible for implementing the robots in the factory. Like we have a project which is called Factory of the Future, and we work on how we could design the factory of the future together with the workers and with designers, and in particular with robot manufacturers and robot integrators, so that this can be done while preserving or protecting health and safety. So it's something we've been taking into account. And there are also other projects within INRS on artificial intelligence, which is spreading very quickly. So we consider artificial intelligence to see how we can make sure that people are protected. And what about the offices? Because increasingly there are going to be softwares, apps used in the offices, and with risk of controls, of people being constantly supervised, constantly monitored, or faced with workloads that is too tremendous. Well, there's not a lot we can do to influence these designers of apps or of other tools. We've seen that with robots from China. You see apps, there's not much we can do when they are designed elsewhere abroad, but this is where the employers can make sure that they do something to improve prevention. And I was saying that one of the conventional risks is due to tools that are used by employees. And it's something you need to pay attention to and also organize prevention. Thank you very much to both of you for shedding some light on the future of hybrid work. Thank you very much for your attention, and obviously you'll be able to access all these discussions online in